I'm about to share 6 simple food hacks that can lower your blood sugar within minutes after eating. Not supplements, not expensive programs, not exotic ingredients, just small changes in how you eat the foods you already have. Changes that dramatically reduce blood sugar spikes, starting with your very next meal. And these are not opinions. They are backed by clinical research and quietly used by endocrinologists every day. If you or someone you love is dealing with high blood sugar, prediabetes, or type 2 diabetes, this video could change how your body responds to food starting today. Stay with me because by the end of this video, you'll know the 6 exact hacks, why each one works inside your body, and how to use them correctly without guessing. Hello, I'm Dr. Emily Carter. And after more than 2 decades, working with patients struggling with blood sugar and cardiovascular damage, I've seen the full picture. I've seen hearts destroyed by years of uncontrolled glucose, kidneys that failed too early, vision lost, nerves damaged, and limbs amputated. But I've also seen something very different. I've seen patients who never added another medication, who simply learned how to eat differently, not what to eat, and their blood sugar transformed. Let me tell you about Thomas. Thomas was 71 years old and had lived with type 2 diabetes for over a decade. His A1C was 8.9. Despite medication, despite trying to eat better, his fasting blood sugar stayed between 180 and 220. After meals, it often spiked above 280. His doctor told him insulin was the next step. Thomas was terrified. Instead, I taught him the I6 food hacks. You're about to learn. He didn't change what he ate. He changed how he ate. 3 months later, his A1C dropped to be 7.1. Fasting glucose fell into the 120s. Post-meal spikes rarely passed 180. No insulin, no new drugs, just food timing and strategy. Then there was Linda. Linda was 68, technically pre-diabetic. Her fasting glucose was 118 as. Her A1C was 6.2. Her doctor told her diabetes was almost guaranteed. Linda learned these same 6 hacks and applied them consistently. 1 year later, fasting glucose, 94. A1C, 5.6. She completely reversed her trajectory. Same hacks, different starting points. Both succeeded. Now, before I show you the 6 hacks, you need to understand why blood sugar spikes happen in the first place. Because once you understand the mechanism, everything you're about to learn will make sense. When you eat carbohydrates, they're broken down into glucose. That glucose enters your bloodstream. Blood sugar rises. Your pancreas releases insulin, a hormone that acts like a key, allowing glucose to move from your blood into your cells for energy. That's how it's supposed to work. But in type 2 diabetes, the problem is insulin resistance. The key no longer fits well. Your pancreas pumps out more and more insulin, trying to force glucose into the cells. Eventually, it can't keep up, so blood sugar stays high. Toxic high. And that excess glucose damages blood vessels, sticks to proteins, accelerating aging, inflames tissues, harms nerves, eyes, kidneys, and the heart. Your cells are starving for energy while floating in sugar. The goal is not perfection. The goal is fewer spikes. And that's exactly what these 6 hacks do. They slow glucose absorption, improve insulin sensitivity, and change how your body processes the same meal. Now, let me give you all 6 hacks first, then we'll break each one down so you know exactly how and when to use them. Here they are. Hack number 1, eat your vegetables first. Hack number 2, add vinegar to your meal. Hack number 3, take a 15-minute walk after eating. Hack number 4, cool your starches before eating them. Hack number 5, add cinnamon daily. Hack number 6, never eat carbohydrates alone. That's it. No cost, no pills, no extreme diets. Now let's break them down one by one, because how you apply them matters. Let's start with hack number 1, because this one alone can change how your body responds to food. Immediately. Hack number 1, eat your vegetables first before you touch protein. Before you touch rice, bread, or potatoes, you eat our non-starchy vegetables first. This works through 2 powerful mechanisms. The first is physical. Vegetables are rich in fiber. When fiber enters your stomach first, it forms a gentle mesh in your digestive tract. So when carbohydrates arrive later, glucose has to move through that fiber barrier. The result is simple: slower digestion, slower glucose release, smaller blood sugar spike. The second mechanism is hormonal. Vegetables stimulate hormones like GLP-1, which slows stomach emptying and improves insulin response. A study published in Diabetes Care tested this exact idea. Participants ate the same meal price with the same calories. The only difference was food order. When vegetables were eaten first, protein second, and carbohydrates last, post-meal blood sugar was almost 30% lower. Same food, different order, completely different blood sugar response. Here's how to use this in real life. At every meal, eat your salad or cooked vegetables first, finish them completely, then eat protein. Carbohydrates always come last. It may feel unusual at first, but the very first time you try this, check your blood sugar 2 hours later. Most people are shocked by how much lower it is. Now we're hack number 2. And this one surprises people because it's been used quietly for decades. Hack number 2, add vinegar to your meal. Vinegar contains acetic acid, and it affects blood sugar in several ways. First, it slows stomach emptying. Food leaves your stomach more slowly, which means glucose enters your bloodstream more gradually. Second, acetic acid improves insulin sensitivity. Your cells respond better to the insulin you already make. Third, vinegar partially blocks enzymes that break starches into simple sugars, so fewer sugars reach your bloodstream at once. Research published in Diabetes Care showed that 2 tablespoons of vinegar with a high carbohydrate meal reduced blood sugar spikes by more than 30%. Another study showed insulin sensitivity improved by up to 34%. Ace, here's how to use this safely. You want 1 to 2 tablespoons of vinegar with meals. Apple cider vinegar works well, but any vinegar is fine. You can add it to salad dressing. Mix it into water and sip it during the meal. Use it in marinades. Never drink vinegar straight. Always dilute it to protect your teeth and throat. And if you have digestive conditions that slow stomach emptying, talk with your healthcare provider before using this regularly. Now let's talk about hack number 3. And this may be the most powerful one of all. Hack number 3. Walk for 15 minutes after eating. Timing is everything here. Not before the meal, not hours later. Within 10 to 15 minutes after eating, you move your body. Here's why this works so well. When muscles contract, they pull glucose out of the bloodstream without needing insulin. Your muscle cells use transporters that activate during movement and act like sponges, absorbing glucose directly. This is called insulin-independent glucose uptake. You are literally clearing sugar from your blood using muscle activity. A study published in Diabetologia found that 3 short walks after meals were more effective than 1 long walk at any other time of day. The blood sugar spike was blunted immediately. Here's how to do it. After eating, walk at a comfortable pace, 10 for 15 minutes. Indoors or outdoors, you don't need speed. You need consistency. If walking isn't possible, any gentle movement helps. Seated leg lifts, arm movements, standing and sitting slowly. The goal is muscle activation right when blood sugar is rising. If you combine vegetables first, vinegar with meals, and post-meal movement, many people see 20 to 40-point lower readings after meals almost immediately, and we're only halfway through the hacks. Because the next 3 focus on how food chemistry changes after cooking, how spices improve insulin response, and why carbs should never stand alone. Stay with me, because you're done. Hack number 4 involves something you probably already do in your kitchen, and it changes how your body digests starch completely. Now let's move to hack number 4, Harfrey, and this one surprises almost everyone the first time they hear it. Hack number 4, cool your starches before eating. This hack changes the chemistry kind of carbohydrates. When you cook foods like rice, potatoes, or pasta, the starch inside them is very easy to digest. Your enzymes break it down quickly. Glucose enters the bloodstream fast. Blood sugar spikes hard. But when you cool these foods, something remarkable happens. A portion of the starch transforms into what's called resistant starch. Resistant starch behaves more like fiber. Your digestive enzymes struggle to break it down. That means less glucose released, slower absorption, smaller blood sugar rise. Studies published in the European Journal of Clinical Nutrition showed that cooling and reheating rice reduced its blood sugar impact by rates up to 40%. And here's the key point. The resistant starch remains even if you reheat the food. Here's how to use this hack. If you plan to eat rice, potatoes, pasta, cook them ahead of time. Let them cool in the refrigerator for at least 12 hours. Then eat them cold or gently reheat them. This does not work the same way with bread, but it works extremely well with rice and potatoes. If you eat starches regularly, this single habit can dramatically reduce their effect on your blood sugar. Now let's move to hack number 5. And this one comes from a spice cabinet. Hack number 5, add cinnamon to your meals. Real cinnamon improves how your cells respond to insulin, specifically Ceylon cinnamon, not cassia cinnamon. Cinnamon contains polyphenols that enhance insulin receptor activity, slow carbohydrate digestion, reduce post-meal glucose spikes. A meta-analysis published in the Annals of Family Medicine showed that cinnamon reduced fasting blood sugar by an average of 24 milligrams per deciliter and lowered A1C significantly. That's not a small effect. That's clinically meaningful. Here's how to use it. Use 1 to 2 teaspoons per day. Spread across meals. You can add it to coffee or tea. Sprinkle it on yogurt or oatmeal. Mix it into smoothies. Use it in cooking. Important safety note. Use Ceylon cinnamon. Cassia cinnamon contains high levels of coumarin, which can stress the liver if consumed daily. Ceylon cinnamon is much safer for long-term use. Now we reach hack number 6. And this one ties everything together. Hack number 6, Never eat carbs alone. This is one of the most important principles of blood sugar control. When carbohydrates are eaten by themselves, digestion is fast and glucose enters the blood rapidly. But when carbs are eaten with protein, fat, fiber, everything slows down. Protein and fat trigger hormones that delay stomach emptying. Fiber creates a physical barrier that slows absorption. The result is a much gentler blood sugar rise. A study in the American Journal of Clinical Nutrition showed that adding protein to a carb meal reduced the glucose spike by more than 30%. Adding fat had a similar effect. Combining both worked even better. Here's how to apply this. Never eat carbs naked. If you eat toast, add eggs, avocado, nut butter. If you eat fruit, pair it with nuts, yogurt. If you eat rice or pasta, make sure there is protein, vegetables, healthy fats. This does not mean unlimited carbs. Portion size still matters, but for the carbs you do eat, pairing them correctly changes how your body handles them. Now let's bring all 6 hacks together. With a real example, imagine dinner, grilled chicken, rice, steamed broccoli. Here's how you apply everything. First, the rice was cooked earlier and cooled in the refrigerator. That's hack number 4. Second, you eat the broccoli first. That's hack number 1. Third, your salad or vegetables include vinegar. That's hack number 2. Fourth, you sprinkle Ceylon cinnamon into the meal or beverage. That's hack number 5. Fifth, you eat the rice together with the chicken, not alone. That's hack number 6. Sixth, you take a 15-minute walk after eating. That's hack number 3. Same meal, completely different blood sugar response. This is how Thomas lowered his A1C without adding insulin. This is how Linda reversed prediabetes. Not by changing or what cage they ate, but by changing how they ate. And here's the most important thing I want you to hear. You do not need to use all 6 hacks perfectly. Even 2 or 3 used consistently can create meaningful improvement. Start simple. Pick 3. Vegetables first, post-meal walking. Never eating carbs alone. Use them for 1 week. Track your blood sugar. Then add the others. Small changes, big results. In the final part, I'll show you how fast results usually appear, how to track progress correctly, and what to discuss with your doctor, so you can use these hacks safely and confidently. Now let's talk about results, because this is where most people lose motivation if they don't know what to expect. Efrash, how fast? Do these hacks work? Some effects are immediate. The very first time you eat vegetables first, add vinegar, walk after a meal, you can often see a lower glucose reading Kristen. That same evening, many people see post-meal numbers drop by 20 to 40 points. Count right away. That's not magic. That's physiology. Your body is responding differently to the exact same food. Over the next 7 to 14 days, something more important happens. Your average blood sugar begins to fall. Not just spikes, but your baseline. That's when fasting glucose improves, energy feels more stable, cravings reduce, brain fog lifts. After 2 to 3 months, these daily improvements show up in your A1C. That's what your doctor measures. That's what determines medication decisions. Now let's talk about how to track progress correctly, because this matters. How to measure progress the right way. Do not obsess over single readings. Blood sugar naturally fluctuates. Instead, look for patterns. Here's a simple system. Check your blood sugar before a meal, 2 hours after. Do this for the same meal type on different days. Compare. Meals without the hacks. Meals with the hacks. You're looking for trends, not perfection. If your post-meal spikes are smaller and your fasting numbers gradually decline, you're moving in a right direction. Write it down. Seeing progress reinforces consistency. Now, an important safety note about medications. These food hacks do not replace medication on their own. Never stop or change medication without your doctor. However, as blood sugar improves, medication needs often change. That's a good problem. That's when you talk to your doctor and say, "My numbers have been improving consistently. Can we review my doses?" Doctors respect data. Bring your log, let the numbers speak. This is how people safely reduce medications over time. Now, let me address a question I hear constantly. Why has no one told you this before? It's not because these hacks don't work. They do. The research exists. The problem is that medical training focuses on drugs, procedures, emergency care nutrition, and food timing get very little attention. There is also no profit in telling people to eat vegetables first, walk after meals, add vinegar. No company funds ads for that. But lack of marketing does not mean lack of evidence. These hacks are used quietly by clinicians who understand metabolism. Now you understand them too. Let me give you a simple starting plan. Your 1-week action plan, starting with your every next meal. Day 1 to 7. Eat vegetables first, never eat carbs alone, walk for 15 minutes after eating. That's it. Do nothing else for now, just those 3. After 1 week, add vinegar with meals, cooling starches, cinnamon. Small steps, high consistency. That's how habits stick. Before we finish, I want to say this clearly. This is not about perfection. You will not do this perfectly every time, and you don't need to. Blood sugar control is about direction, protein, not extremes. Each better meal protects your blood vessels, nerves, kidneys, eyes, heart. Each stabilized spike reduces long-term damage. You are not failing when you miss a hack. You are succeeding when you return to it. Now, if this video helped you, I want you to do 3 things. Dar ichand Christine. Call to action first. Subscribe to this channel. Here on Dr. Emily Carter, my goal is simple. Clear, evidence-based guidance that actually helps you live longer and better. Second, share this video. Someone you care about is struggling with blood sugar right now. These hacks could change their trajectory. Third, leave a comment. Tell me, which hack are you going to try first? Vegetables first? Post-meal walks? Cooling starches? I read every comment, and I love seeing progress stories. Remember this. Blood sugar is not just a number, it's a signal, and today, you learned how to change that signal using the food you already eat. Use it. Your future self will thank you. I'm Dr. Emily Carter, and I'll see you in the next video.